How's the royal family? I pray that everyone is doing well. Well, I've been off a bit, my royal family. Some of y'all know and some of y'all don't know. My ex-husband passed a few days ago from coronavirus. Which is my youngest son's father. So I would ask the royal family to keep my son's family in prayer, and that's my youngest son, Cleveland. Usually you hear from my oldest son, Delbert. He gets on and chit chat from time to time, or y'all see him making comments when I do premiere. So I had to deal with my immediate situation, and just basically just being there and supportive of him. And I thought it would be fitting to put up what y'all are reading right now. Despite my son's father passing, I still don't believe the propaganda that America pushed down our throat about coronavirus, and saying that we disproportionately get it more than anyone. Lisa made a statement to me more than once. And she said if we were getting it at the rate that they say that we are getting coronavirus, why are they pushing so hard to get this vaccine out? And I have said it, and many have said it. That vaccine is not even working. And I just had a deep chat with Lisa, and she was saying over there in the UK, with some people that already didn't had a reaction to it. And she said immediately after they got the shot, they hadn't even left the facility. And, they've been kind of sort of debating on who would get it first. So naturally they want the medical personnel to get it. And I have people that work in the medical field, and I ain't heard not a one yet say in my family that they taking the shot. They're adamant about it. No, because they seeing it up close and personal. So basically what I'm showing here is this propaganda. And I really think that they put this up for the enemy and for us too as well, for the enemy to feel comforted, like, oh yeah, it's them that's getting it more than us, and this always to keep us in a state of terror. Now, I live in the state of California. California has shut down completely. Coronavirus is extremely bad in California. And so I'm not reading nothing tonight. I'm speaking strictly from the heart, my royal family. I have a couple of videos that I want to show y'all how bad it is here in the state of California. So let's get into this first video.
So yeah, our health officials are really sounding the alarm. Interestingly, Dr. Mark Galley today pointed to Europe as a model for us. He said when Belgium enacted their recent stay-at-home order, they were able to lower their positivity rate from 21% to 8% in just over 3 weeks. He's hoping the same can happen here. Today's update from Health and Human Services Secretary Dr. Mark Galley unfortunately gave no sign yet of things turning around. The 14-day positivity rate across the state is 8.7%, a 55% increase since the week of Thanksgiving when it was 5.6%. ICU patients also continue to rise. Here's the latest numbers by region. The Bay Area has 24.5% ICU capacity. Northern California has 25%. Greater Sacramento has 18.8%. Southern California 10.1%. And San Joaquin Valley just 5.6%. Each of those numbers is slightly lower than the numbers reported the day before.
We are worried about a rapidly accelerating increase in pressure on our hospitals. If we thought we were sort of peaking at this level, some of the regional stay-at-home orders may not have been necessary.
Dr. Galley said the increase in transmission from Thanksgiving is just now starting to show up in our case rates. He's asking people who have travel plans for the upcoming holidays to cancel them. He also defended the decision to close outdoor dining.
It really has to do with the goal of trying to keep people at home, not a comment on the relative safety of outdoor dining.
Medical staffing continues to be the state's biggest challenge. I asked Dr. Galley to explain the state's new 2-day training program for nurses to work in the ICU.
We've heard from nurses who are pretty alarmed by the proposal, saying that that's a very short amount of training for a nurse and that it could be unsafe for nurses and the public.
The 2-day training that the state has put together is really meant to give nurses who may find themselves in a situation pitching in, helping out with critical patients, a bit of the different thinking that goes into providing care in an intensive care setting. It is not meant to create a cadre of now suddenly appointed, anointed, trained ICU nurses.
Now, we did ask Dr. Galley where in the state this training is happening. He didn't give those details. His overall top-line message to everyone today: he knows there's COVID fatigue, but the situation is likely going to get worse before it gets better, and the best thing we all can do is just stay home.
You know what? 2-day of training ain't shit. Let's just keep it real, my royal family. 2 days of damn training. These people are not dealing with this shit right at all. For it to be at this capacity, because in America, the way the overall Americans can be, and I'm not saying all, please hear me, you want to continue to do exactly what you're doing. You don't want to sacrifice. You want either some kind of quick shot, a quick pill, and you can just keep leading the way you lead your life. And I'll give you an example. I went to the doctor one time last year. And the doctor that I see, he gets a monthly magazine. It's an HIV magazine. And you know how in the magazines they advertise different type of medicines. And they had this one particular medicine that you can take where if you have a one-night stand and you think that person might possibly have HIV or something, you can take that and your chances of getting it, I guess, is lower by taking whatever that poison is that you're taking. So they're basically encouraging you to live a promiscuous lifestyle. That's what they're saying at the end of the day. And this is how we are affected by the system, and even the enemy is affected by the system. And when I checked it, I was like, damn, that is really irresponsible. And it's just simple things that you can do to not spread coronavirus around. Okay, we know that there was going to be a big surge after Thanksgiving, and it's going to increase even more because now people got this strong need to be with, unquote, family. I mean, wow. Well, as we continue on, let's get a little bit deeper of the things that's going on in California. Now, this is a trip right here when y'all hear this one. I don't want to spoil it. I want y'all to absorb this.
Back to Amy Holyfield, who's out there at a marina playground in San Francisco regarding the playground's reopening. And Amy, it's supposed to be tomorrow, but some are opening today, or what's going on out there?
That's right. This one is open, and some kids have figured it out. Some parents have figured it out, and they are using it right now. I do have video of the moment that parents and caregivers have been waiting for, so take a look. A Rec and Park employee stopped by here at this Moscone playground around 10:15 and unlocked the gate. He took down the sign that said the playground is closed. The state had said playgrounds needed to be closed as part of the shutdown to slow the spread of the virus. But many high-profile people question that, including SF's Rec and Park director and UCSF's one of their doctors, and some San Francisco supervisors, one you're about to hear from. But first, you're going to hear some reaction. It was really fun to get to share some good news this morning.
That's great. That's great. Yeah,
we go and see if there's a lot of kids, and then if there's not, we go in, and if not, if there is, then we go do something else and come back and go in if there's not a lot. So, yeah, that'd be great.
It's a huge relief for families. I got a ton of folks who reached out to me so concerned about having playgrounds shut down. Kids need to have a safe, healthy place to go. We can do it in playgrounds. Folks wear their masks, distanced. It would have been just soul crushing to have all of our playgrounds here in San Francisco and across the state shut down for the entire next month. Kids are already doing distance learning. Schools are shut down. Families are sometimes in a small, crowded apartment. They need to have a place to go outside and play.
Supervisor Matt Haney says he wrote and called the state asking for this change, pointing out the state did not provide evidence that kids are catching COVID at playgrounds. The state made this change very quietly. No big press release or press conference. Just made the change to the frequently asked questions section on their website. We have reached out to the state, to the governor's office, but have not received a comment on why they decided to make this change.
All right, let me take that down.
Now's the perfect time.
Now, so parents were, bitching and complaining that their children couldn't play in a playground. This is something I'm telling y'all that I know. Playgrounds are extremely filthy. You see, they even putting it in the mind of the children that, I have the right to go play at the playground and go do what I want to go do. Now, some people do have backyards. Y'all need to get inventive. Do shit in the house. Do you see the blessing in it? Do you see it? You're just bitching and complaining. Now, in the sand, you can get scabies, you got sand fleas, you got people that shit and piss, especially in San Francisco, in that sand. You don't know telling what's in that sand. Is somebody out there sanitizing the play sets and the kids that are on? You know what? See, what people are not understanding, they want to go back to unquote normal. Now, we in the royal family, we don't know what normal is. We don't know what freedom is. We're always under a constant state of terror. And then they get inconvenienced, a little inkling, and they bitching. Okay? I totally disagree with these playgrounds being opening, because children naturally want to get together and play. That's what children naturally want to do. But you got to get inventive. But see, the parents, they don't want to be bothered, and they want to have their break and all that. I'm telling you, this is how America gets down. Nobody wants to be overall inconvenienced, or let's say the enemy don't want to be inconvenienced. They want to have things their way. That's why coronavirus has spread it the way that it have spread it. So let's get into this next video. Let's see how serious and the side effects and stuff, because that now they now I want y'all this here. They said, how serious are the side effects for the COVID vaccine? Okay, read in between the lines. That's all I'm asking the royal family to do, and y'all smart enough to do that.
Pfizer's vaccine results in A+ and a grand slam. New data released by the FDA today showed it worked very well regardless of race, age, or weight.
The trials also showed no serious adverse effects, but some people did experience minor symptoms. What do we know about the vaccine's side effects? Good question. Heather Brown tells us why it might be a good idea to plan a day off after you get the shots.
If you were to get the vaccine, would you expect any side effects?
Perhaps.
The body aches.
Or a fever.
Fatigue. It's so tough to say because we don't know. Everybody's side effects will be different.
According to Pfizer's data, 66% of participants experienced pain at the injection site after the second dose. 60% fatigue, 52% had headaches, 35% chills, and 2% vomited.
That's a little higher than for most vaccines. That probably is not a bad thing. That means you're getting good immunity.
Dr. Frank Rame is an infectious disease specialist at Allina.
Just to be clear, if you're not feeling so great after you get the vaccine, that doesn't mean you have a mild case of COVID or a weakened case of the virus.
No, you can't get COVID from this for sure.
It's your body's immune response mounting to that protein that the mRNA is coding for.
That's the way it was with the measles vaccine. That's the way it was with the oral polio vaccine. These are live, attenuated, weakened viruses. That's old stuff. We don't do that anymore.
On average, the Pfizer vaccine side effects lasted for a day, similar to what these trial participants reported.
I was shivering and my teeth were chattering.
I had some soreness in my left arm, which is my vaccine arm.
It only lasted that one day, and then it was gone the next day after that.
Right now, the trials can tell us what the short-term side effects might be, but could there be long-term side effects to this COVID vaccine?
That's why we need people to stay in our trials for 2 years to find that out.
He said it's rare, but it's happened. In 1955, 1 in 100,000 reported paralysis after getting the polio vaccine. In 1976, 1 in 100,000 reported a nerve disease after the swine flu vaccine. Both vaccines were stopped.
Every one of those side effects occurred in the first 6 weeks after vaccination.
Long-term effects we're not going to know, but there are usually very few long-term effects.
So precedent would suggest that we're not going to see late problems.
So experts say it's important to understand
if my trade-off is a headache or a fever,
the vaccine is a far better choice than the illness.
I've had COVID, so I don't want to get it again.
Heather Brown, WCCO 4 News.
Some Twin Cities hospital systems told Heather that they won't vaccinate their frontline workers all at once.
That way workers won't be dealing with potential side effects all at the same time.
All right. So I ain't never ever heard of a vaccine that you take and then you got to take off for work and then they want you to come back and take the second one. So you can't trust these people. You can't trust these people at all. And then they want you to be out there to be the guinea pig. But overall, they want the royal family. Let's not forget what I put up here. Do I still have it up here? Yeah, let's not forget this, all right? You know, they'll put that out there. Hopefully, they'll use enough scare tactics that we'll run like cattle and, be tested on. And you heard what they said. Well, we need them out there for 2 years. No, they lead you out there for infamy and stuff. See, the medical industry have used us for guinea pigs for a long time. I don't think they ever stopped. And we fear the medical industry. We don't know what those people may do to us, and they have killed many of us. This shit is serious. And I predict that vaccine ain't gonna work at all. All right? I want y'all to listen to this.
The coronavirus pandemic not abating. At least 43 states are over the crucial 5% test positivity threshold. More than 96,000 Americans now hospitalized with the coronavirus, another high for the country.
We have to do everything we can during this very serious time when our hospitals are really being hit to slow down the transmission.
Governor Mike DeWine said more than 5,000 people are hospitalized with the coronavirus in Ohio, the most for the state throughout the entire pandemic.
Our numbers have just risen so quickly and so drastically.
We're seeing healthy individuals come in and they decline so quickly.
This field hospital in Rhode Island is starting to receive patients after hospitals in the state surpassed their capacity.
We're expecting to be taking care of a lot of folks here. We didn't have to be here, knowing that had we as a population come together and all stayed safe and stayed distanced and stayed home and stayed masked, that we could have avoided this.
And in California, the recent surge of new cases forcing Los Angeles County last weekend to implement another stay-at-home order for its 10 million residents. The governor warning new restrictions could be coming as the state predicts some hospitals could be near capacity by Christmas without intervention.
People just want to be done with this, but it doesn't take a break just because we're tired of it. We need to recalibrate for a short period of time what we do to keep this transmission down.
As experts warn, Thanksgiving travel and gatherings will likely cause a worsening surge in coming weeks. The CDC Vaccine Advisory Committee expected to make recommendations later today on who will receive the vaccines first when they are available.
What's important to note is the number of doses, the amount of vaccine that we have is still limited in comparison to the needs. So it's going to take a while for all Americans who need it on a priority level to get it.
Drug makers Pfizer and Moderna have submitted their vaccines to the FDA for emergency use authorization. The FDA will consider Pfizer's vaccine on December 10th and Moderna's 1 week later on December 17th. Dr. Anthony Fauci urging Americans to get a vaccine.
You want to be part of the solution. Get vaccinated.
All right. Yeah, whatever. We don't believe you. We don't trust you at all. Now, look at this map here in California. Let me blow this up a little taste here. And you see the tiers. You got tier 1, 2, 3, and 4. So tier 1 and 2 would be considered bad, but all of it is bad because you see here the entire state of California, folks got corona, and what I was thinking, the night that my son's father passed, I was up, and that empathic energy be kicking in with me, and I was thinking, damn, I don't know anyone that close to me that have had it or anything. I haven't known. Now, no, not only did I know somebody that had it, I know somebody that died of it. And he went, I don't know if I said this or not. He went in the hospital on a Sunday and he was dead Wednesday. And I found out he did have some underlying issues. He was diabetic. He was on dialysis. And he just happened to be a person that didn't really take really good care of himself and stuff. And it's sad and it's tragic that even if you have some underlying health issues, then your immune system is compromised. And I'm going to keep saying this over and over again. You can email me because I'm not going to put the information out. I know things that you can take that you won't get coronavirus, or if you have it, you can shorten that. And I can testify. I know of 3 people that have had it, and the supplements that I take that's in my home, they took the same thing and they don't have coronavirus. They don't have any side effects or anything like that. One thing is that our Father put everything here on the planet for anything that ails us. But we know ultimately at the end of the day, the medical industry, this is another avenue for them to make money. And we are at a pandemic state. People are frightened and everything. And you just have to, I often talk about dealing with your immediate situation. You got to take care of your immediate situation. Do you have enough love for your family? Do you have enough love for yourself to do what you have to do? I done took up wearing double masks now because this shit is bad. It is real bad. And I limit where I go. I can still go outside. I can still take a walk around my neighborhood and all that kind of stuff like that. They don't mean that you chained in, but also look at the blessing in it, my royal family. We have to take care of each other, my royal family, and we got to do what we got to do. I highly recommend do not send our royals back into the school system ever. Coronavirus is not going to go nowhere, They ain't eradicated the flu. They can't cure the common cold or anything like that. So all these states are affected. And it's simple. We can't take on the thinking of the enemy. This is their system and they dying with it. And you'll die right along with it, going along and getting along and believing stuff like this, like we disproportionately getting it off. We disproportionately getting it as bad as they say, why they ain't putting the money in the community, why they ain't taking care of our immediate situation. They don't give a damn about us. They'll never give a damn about us, my royal family. They want us to be the guinea pigs, and like Lisa said, then they can tweak that vaccine so it can work in their favor. And also, find out what's in that stuff. I need to do a video about that because there may be things in there that you may be allergic to. They're not going to tell it all to you. What I'm learning is what the mainstream media is doing is they trying to counteract shit. They trying to counteract us because when you get on the black the new black media, we getting this shit out real quick, like and they were listening to us, but we much faster to the draw on them. So I just wanted to get up here. I gotta get back on my grind and everything. I thank everyone that continue to send the donations in and everything. I immensely thank you, and thank y'all for your patience. I thank y'all for keeping my youngest son, his name is Cleveland, in prayer. He's going through it right now. He has lost his father, and he's in his early 20s and everything, and it's pretty tough on him. I feel really, really bad for my royal son. So, as usual, my royal family, render your voice with your beautiful divine words. And as always, my royal family, I thank you for your love. I thank you for your support. And with that said, Ashe.